Hi there, Dr. Frank Nia with Ponce Dental Studio. I want to talk to you today about the patient journey when you're deciding to get your full arch dentistry with us. Everything starts off with that consultation. It's an opportunity for you to interview us, to really understand who we are and what we do. We're a privately owned practice. That makes a difference. It means accountability starts with the names on that front door. And when you meet the team and you see the environment, it is so important for you to understand who is going to be taking care of you. This becomes an intimate relationship, and that consultation is where we want to start off our relationship with you. So once we've had a chance to take a look at you and say hello, we want to make sure we start gathering some diagnostic information. We generally do a CBCT scan of your jaw to understand the strength of your bone and the health of your teeth. And then we go on to take some additional scans of what the shape of your teeth look like that are currently there and what is the overall health of your mouth. After we've assessed that, we are able to then give you some recommendations. And the recommendations are going to be around your aesthetic needs, they're going to be around your longevity needs, and overall what kind of look and function are you using your new smile for. And based on that, we're able to tailor and customize exactly what it is that you need. Now that we've gathered information, now that you've had a chance to meet us, the decision is with you. And if you choose us to take care of you, the next time we see each other is the day of surgery. The day of the surgery, only one thing matters: your comfort and making sure that we're taking care of you safely. So what do? We make sure that you have the menu of items, whether you choose to be numbed like some of our patients, whether you want to be put to sleep, whether you want to take a couple of happy pills to take the edge off, the menu is for you to choose from. The bottom line of it is we want to make sure that you are absolutely comfortable and that we are treating you in a very safe way. We go ahead and start by removing the teeth that are terminal and no longer going to be with you, and prepare your jaw to accept the implants and the eventual bridges that will be sat on top of them. Once we have the installed arches in your mouth of the upper arch and the lower arch, we are able to then test your bite on the day of your surgery to make sure that everything is lined up and that you're able to function with the set of teeth that are fabricated for you. We also utilize this set to make sure that we have an understanding of what the aesthetics are going to look like for the final prosthesis and make any changes to this version while you're healing and while you're using it. Sometimes our body heals differently, and so we have the flexibility with this interim bridge to allow for some of that healing to happen before we mutually make a decision with you to go to the final product. Now, our practice is very different than most practices that you're going to visit. We have the technicians on site. We have the equipment on site. We build your teeth with our hands and machinery and technology right there within those four walls. So any changes that need to happen, any modifications that need to happen, we are there to make sure that these bridges look absolutely beautiful and function just as well. Those are some of the differences as Ponce Dental Studio, and that was a small view into the journey with us if you choose us to take care of you. Thank you.